My name is Ken Bremner and I'm Chief Executive at South Tyneside Sunderland NHS. We've said to you plenty of times that staff are our greatest assets, and that's undoubtedly true in my opinion. But the areas of equality, diversity, inclusion, I think are becoming very central to what we are about as an organisation. Today is the start of that journey to try and make sure we embed properly equality, diversity, inclusion, whether you work in our hospital services or whether you work in our community services.
Hello, my name is Lynn Cole and I'm a non-executive director here. I want to be a provider of excellent healthcare for everybody that comes into contact with the trust. This is as important for our staff and our volunteers as it is for our patients.
We cannot build a fair and diverse society if we do not include every group.
No, we're not starting from a complete standing start. We've been doing many things under this banner already. And I just want to list some of those for you today. We've identified our own board level champion for this as well, one of our non-executive directors, Lynn Cole.
Proud to be the Trust Equality Champion.
We've implemented, as many of you know, the rainbow badges. We want as many as possible to sign that pledge. We've successfully supported 10 Trust staff recently to access the North East Leadership Academy's Stepping Up programme. We have supported Sunderland Pride, with a number of our staff hosting a stall for members of the LGBT+ community to share their views and experiences with us, and of course to also engage with staff who took part in the parade themselves. We'll continue to work with our partners across the North East and North Cumbria to make sure that we really demonstrate that we are a great place to work.
We can go and discuss issues that maybe you do not find platforms to discuss elsewhere.
We are prepared to continuously improve and reflect going forward. And it's that central theme, golden thread if you like, that actually is going to really demonstrate that we are or will be an outstanding foundation trust in the future.
An included employee is a happy employee, is a content employee. A happy employee is a good doctor, a good nurse, or any other worker in the NHS. And patients who are treated by happy employees will have good outcomes.
My name's Peter Webb. I'm one of the chaplains here in the Trust. We're here for you. Everything that the chaplaincy does, whether that's in the provision of space or a cup of coffee and a biscuit, or a conversation that's totally confidential, it's here for you.
Our board of directors very recently agreed its first equality, diversity and inclusion strategy.
So I'm delighted that we have an equality, diversity and inclusion strategy. That means that our patients are able to get the best possible care and that our staff are able to have access to tools, information, knowledge to enable them to do their work exceptionally well.
We're a disability confident employer.
My team is heavily involved working locally with schools and colleges to support inclusive placements for students who are wanting to access opportunities within the NHS. The Trust has pledged to support the Step Into Health programme, which is a national programme in conjunction with NHS employers. It aims to deliver opportunities for those serving in the armed force, their spouses and dependents, and it offers them an opportunity to gain an insight into NHS careers.
Hello, my name is Mark Tull. I'm a clinical team manager for Gateshead Token Therapies. In the service, we've recently started a wellbeing strategy group, the work-life balance risk assessment tool, and we've used this effectively over a number of years. For people who have kind of long-term physical conditions, changes might include the pattern of working, the hours, their base of work, the amount of travelling. So these assessments are really important for us to do effective support for our staff.
So my name's Kieran Apol and I'm a psychological wellbeing practitioner. I just have dyslexia, and for that I just have a couple of reasonable adjustments just to help me manage my caseload.
This is all about people. Together we can make a difference. Together we can get to a point in the future where everybody, regardless of their background, can get the best possible care.
So there's a lot been going on already, but as I said at the start, this is the start of our inclusion journey as an organisation. And as that develops more fully in the future, we want to share that with you and we want to engage you as part of that process.